traveled across the nation to sing for our freedom. I arrived in Coffs Harbour. No time for vacation. When I walked into the festival, I saw a sight I'd never seen before. A sea of signs waving in the breeze. What was written there I had to see. This was the forest of the fallen. Do you know what this means? In the forest of the fallen, you will see and you will grieve. Every picture told a story of death and injury. From our so-called vaccinations, mandated throughout our nation, there were people moving slowly in the forest of the fallen. I was singing right beside it, could not stop my tears from rolling. This was the forest of the fallen. Do you know what this means? In the forest of the fallen, you will see and you will grieve. The silence, it was deafening. The signs were so shocking. Do you know how many neighbors will never work again, never live again? This was the forest of the fallen. Do you know what this means? In the forest of the fallen, you will see and you will grieve, lest we forget, 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 lest we forget the fallen.
Okay, let's get going. We're going to bring in our guest very soon. Evening, Dr. Listhouse. How you doing?
Good evening, Michael. Good evening, Freedom family. What
You got your
a
raspberry jam glasses on, so the world's looking pretty good. I'm in Cooma. I just want to say thank you to all the people at the stand in the park today in Cooma, National Stand in the Park today. I'll call Brady later and see how he went, but it was lovely meeting them. I've done 3 interesting interviews, which will be going up. But there's some really lovely people here in Cooma if you come. Yeah, so thanks to all of them. How are you, big fella?
I'm good. I'm good. It's been cold. I can imagine it's cold in Cooma, but we've had massive surf and storms today, so it wasn't a good day for a forest in Sydney. But we're not going to stop, and Reese is amongst them. So
Yeah, well, that's right. That's why we played that. So I believe Reese is amongst them. Suzanne, one of the Cardi girls, interviewed him for Died Suddenly or one of those pages. So he'll end up in the forest. So this is Reese here with his grandfather, I believe. This is 2018, and but let's bring on his father. His father is Matt Poole. He's a radiologist. The whole description of his bio and his story is in the show notes. But let's just bring him in and start chatting. Hey Matt, how you going?
Hello, guys. Thanks for letting me join you tonight.
Oh, it's an honor, but it's also a tragic thing because early on, 5 years ago, I was a part of the Melbourne marches, and everyone was saying in 5 years people are going to need heart transplants if they get myocarditis. But I hadn't actually heard of it until Reese. So you don't actually want to be right. It's times in life where you want to be. I'd rather be a fool and an idiot and a stupid anti-vaccine conspiracy theorist than actually be having this discussion. But here we are.
Yeah, what's amazing to me, Michael, is that that I've worked in health for 30 years, and up until Reese's tragedy, I just had no concept, no idea whatsoever of the risks that were involved with this product. And then, of course, I've delved deeper in some other products and it's astounding to me, to someone who's worked in the industry for so long. I'm people say, "Are you anti-vaccination?" And I say, "I'm not sure. I'm fully vaccinated. I've never had a flu vaccine. I've had all my childhood vaccinations. Up until 3 or 4 years ago, I just followed what I was told, and I've had an awakening with what's happened to Reese. I had no reason to believe anything other. So I'm a bit of a late bloomer to understand that things aren't as we're told regularly, and it was just the most eye-opening experience to realise what can go on that you have no concept of. And and as you guys know, you probably woke up long before I did, but it's a bit harrowing to realise what's simply not being told to us. And so I'm here tonight just to tell our story as a family, what we've been through. We've been through a harrowing experience since March 15th, 2022.
Well, let's start just a bit before then. So I believe it was Reese's second shot.
That's right. Yeah, second Pfizer.
Second Pfizer. So before then, from what I see in this image with his grandfather, in this image here I put together here, he was actually, you were a very fit family, exercising all the time, stuff like this. So is that correct?
Yeah, look, I absolutely. I sort of, if I tell Reese's story, there's a default position that a lot of people take, and there's a couple of things, and it's astounding to me to see it's the same questions come out all the time when I say this has happened to my son. Default position number one is, oh, the poor bugger must have had some underlying health condition. And I say, you can cross that off the list. We know that categorically that's not the case. Secondly, he must be 1 in a million that's been affected by this product. This happens sometimes, bad luck. And thirdly, what's the third one? People ask, what's the time frame between his vaccinations and when he had the incident? And I've got a bit of a story there too. But basically, I've got 3 children. My wife and I have 3 children, and they've all grown up playing sport, competitive sport. So Paul is a doctor. I sort of look at when this happened, you say, oh my God, what's happened? Some underlying condition. Well, the first thing I'd look at is, how do you get to 22 years of age without having an incident? Yes, things happen. I understand. There's too many coincidences for me. So I know what happened.
But to get to a heart transplant, I mean, I'm not the doctor here, but to get to a heart transplant, there would have to been symptoms showing that this was, warning signs showing that this was coming. I mean, if he's out there playing sport, surely he wouldn't have been able to keep up. or he would have been exhausted, or he'd been in pain.
Yeah. So he Reece was playing touch football 2 or 3 nights a week, tennis, golf, very active, loved his running, loved his riding his push bike. We know the heart's at its weakest when you're exercising, so that's fair enough. I work in radiology, so radiologically, we have an X-ray when Reece was 18 years old, and he's got this beautiful little heart sitting in his chest cavity. The ultrasound after this incident and chest X-rays afterwards, he's got a monster of a heart, as Paul knows. He's got dilated cardiomyopathy. So something has happened to his heart. The evidence we got from when he was 18 years of age to when he had this incident at 22. So within that 4-year period, if we want to have a wide time span, something's happened to his heart. So yes, could he have had a virus or something else?
Can I just bring in Dr. Paul? Paul, can you explain to us why the heart expands and how it would go from this, powerful little heart to this monster of a heart?
Yeah, but that the issue of myocarditis, I think, is there is a spectrum from undetectable disease, microscarring, where someone functionally looks normal. Even if you do an X-ray or an ultrasound, you won't see anything, and they still drop dead because these micro scars will affect the way electricity conducts through the heart, and it can just go into fibrillation and people can die. So you don't need necessarily massive scarring or even a heart which isn't beating normally to have lethal effects from a damage from a toxin, and that's in effect what happened. What happened with Reece is like the other extreme, where it's undeniable. There is severe heart failure. As the heart fails, it dilates to try and compensate to get the heart out, get the blood around. And he needed ECMO, and he had a cardiac arrest, and he was very fortunate that as Matt says, he got great care ultimately, but that doesn't mean that the experience, and he survived, but there were many who didn't. And Reece's case is right at the worst end of the spectrum of disease. But, what I worry about is, speaking of, this isn't quite your area, Matt, but this is PET scanning, when Nakahara did a paper where they looked at glucose uptake, which is the same test that they use for diagnosing inflammation or cancer surveillance. I'll just show you, this is a paper by Nakahara, and you can see on the left there, you've got hearts that are not lighting up, there's no inflammation, and then next to it, you've got people who had the COVID synthetic gene jabs, and you can see the heart just lights up. There's there's abnormal glucose metabolism, and I believe that corresponds with myocarditis or inflammation, which is not. They say it's rare. I think nearly all the vaccinated people had their hearts light up in ways that non-vaccinated people didn't. So I think it's common. And again, with this wide spectrum from very mild, undetectable, up to severe heart failure, which is what Reece had.
So, Paul, one of the very sad situations about why so many people were let down after Reece's arrest. We ended up at one of the major public hospitals, and after 60 odd minutes, Reece hadn't been resuscitated. And we thought we'd lost him despite the very good early basic life support and defibrillation. His chart said that he was down, non-responsive for 66 minutes. There was obviously some heart activity. So obviously he was intubated. They did bring him back. I'm a radiographer, not a radiologist, Michael, so I'm not a doctor. But
okay, sorry, man.
So I don't have the knowledge that Paul does. But and I spoke to the cardiologist presenting in ICU the following day when we didn't know if Reece had irreversible hypoxic brain injury He was intubated. We didn't know how he was going to respond. We actually didn't know what had happened to him. And I asked the cardiologist there, I said, because there was just a little bit of noise about problems. And as I said, I was a bit slow to understand the effect of these products. And I said, could this be a vaccine injury? And verbatim, the response from the medical specialist in ICU was, no, we don't think so. The time frame doesn't fit. And it was an extraordinary, to me at the time, I went, oh my goodness. And I actually thought, this is a novel product. How do you know the time frame? Are you saying if we give this injection and somebody keels over within 24 hours, yes, you'd say that's a causal relationship. So I found that astounding, but really interesting. That same specialist who made that comment when we sought independent cardiologists to comment on Reese's case. And apparently this particular doctor had changed his tune on the subject, and he said, yep, actually, yeah.
Wow.
We don't know the time frame of heart damage. And as Paul said, my understanding, I think it was the Nakakara study that said, I think it was 180 days post second Pfizer, I believe, I think it was Pfizer, that they were seeing still elevated troponin, I think, and scarring of the myocardium. So, you know, we had no idea what the effect was. I was told that personally, we were as parents, that no, it couldn't be a vaccine injury because the time frame doesn't fit. And, you know, that's quite alarming to me that, and of course the medical personnel were also encouraged, we should say, not to make any
you wouldn't want to produce
any
drugs.
correlation.
You wouldn't want to produce any vaccine hesitancy, so you don't discuss the obvious. You know, recently there's been a large data dump from Japan that Steve Kirsch has looked at, and he can look at the time of vaccination and the time of death, the date of death, and compare it with non-vaccinated cohorts. And the peak is around 2 months. You know, so we would look. That was the initial thinking. If you got through the first couple of weeks, you're probably okay. Well, sure, there were a lot of early deaths in the first 2 weeks, but it appears now from the record level data, like the Czech study and the Japanese data and New Zealand data, which I saw when I went there, it's delayed. It's delayed, and there are excess deaths. And everyone, we had no idea what we were dealing with, but we do now.
And you know, if we're honest, it's too late. It's too late. We didn't know. The product was approved, recommended. We were coerced, and so many people were mandated through their employment. And it's too late. So if we're realistic, absolutely nobody wants this information to get out, and obviously the government doesn't want to acknowledge if they'd made an error. And I think that's just.
I see it like an airplane crash investigation, though. This is a disaster, and it's a man-made disaster. So we need to figure out what went wrong, so that we don't have it happen again. That's why, like the Air India disaster, they're looking at. But can I ask you, can we go back a bit? Can you say what were the first things that Reese started to notice when, you know, that I read about when he was on the beach, but tell us, what was the first thing, and how long did it take you to realize, okay, this is really bad? You know, because usually parents go, oh yeah, I'm sure it'll be fine. I'm sure it'll be fine. Yeah. What was the border you crossed where you thought, okay, this is really bad?
Well, and I think that's the insidious thing about this product was that yes, some people probably did have anaphylaxis, or they probably did die from sudden arrest early on. Reese's symptoms he developed, but he's a 22-year-old healthy young boy, so you know we're not hassling him and checking on him, and he's a bit flippant about his own health. But he developed night sweats and exertional fatigue. He was still playing his football. He said, and in fact, he said one of his teammates had commented. They said, "Oh, geez, you're running like an old Corolla type thing." He just didn't have that fitness that he normally, you know. So there were those changes, but we didn't, and that's the thing that makes me cranky as well, that we simply at that early stage, as Dr. McCullough says, that as a cardiologist, anyone with myocarditis, he says you don't do physical activity for 6 months. And there was none of those early warning signs, warning messages early on. So within a week or so, Reece was getting those type symptoms, and that exertional fatigue as he continued to work and socialise and play sport.
Was he bringing this up with you? Was he?
Oh, look, I think we just weren't aware, Michael.
Yeah,
I get
it.
And we just weren't aware.
Sometimes young men keep it to themselves. You know what I mean? It was, And what was his job, just out of interest?
Reece worked as a property analyst in commercial real estate.
Okay.
Yeah. So he was going well. He was starting to sort of progress through his career, and obviously he's not working now.
Yeah. Yeah.
So they were the early signs, and then but that's when he had the cardiac arrest. I don't know if you want to go through the whole thing, but he spent 3 or 4 weeks in ICU.
No, let's take time, because this is for people hearing it. Even if other people are out there listening who might actually go, because there's a lot of people have already said that this happened to their son as well. Yeah.
And as you guys said early on, I hope he's not listening. We understand totally how blessed we are that he's still with us, and so he had his arrest. I think, Paul, what's the statistics? 5 to 6, 8% chance of survival with an out of hospital cardiac arrest. He survived with that amazing basic life support. Spent 3 or 4 weeks in intensive care. He had a defibrillator inserted into his chest as an insurance policy, an implantable cardioverter defibrillator, in case obviously you're more prone to more arrests if there's scarring there on the myocardium. But even from the outset, it was extraordinary how little there was no discussion. There was no that discussion with the doctor in ICU initially was the only discussion we had about causation. And so you sort of think it's fairly insensitive to parents that all of a sudden their child's had this life-changing episode, and nobody wanted to go there. So that was in March 2022 when he had the arrest, spontaneous sudden arrest, and
how did he handle it himself?
Look,
the only reason I'm asking is usually when you're 22, if you're fit and a young man, you feel indestructible, and so suddenly, and your heart, you take no notice of your heart at that age. You know what I mean? How did he handle it?
I think when he got home out of hospital, it's as a young man, he probably thought, oh, well, something's bad has happened, but we can get on with life now, and we can get on. And even as parents, and I work in health, you don't fully understand you probably don't want to go there with what the prognosis is with these things. And I know even the initial ultrasound in emergency, there was a mention of heart transplantation. I went, what are you talking about? This guy's fit and healthy. So I learned a lot. I'm not a cardiologist, so I didn't fully understand medically. But then over time, so he did get home. He tried to continue working, but the fatigue was just getting too intense. So obviously the social activity, there was no physical activity, and he was living with heart failure for probably 18 months to 2 years. He had multiple hospitalizations during that period for infections. These infections appeared out of the blue. Tonsillitis, and I think there was glandular fever, I believe, at the time. And
glandular fever.
Yeah, I'm pretty certain that was one of the diagnoses. But when he was, and then of course there were hospitalizations as time went on to as a workup for transplantation, and I suppose when that I had to get my head around and say, oh my God, Reece needs a heart transplant to survive, and that was very difficult to have that realization. I suppose when the initial arrest happens, what we were told was, and Paul, I hope this is true, they say 30% 33% of cases, heart function can improve. A third of cases stay static and a third deteriorate. And I think that was probably maybe some porkies. I think the majority of heart failure cases continue to deteriorate over time.
So I have just before you go on, I just want just to give you some. I don't know how to put it. I have a friend exactly the same age as me. He's one day older, and he's quite a famous actor. I won't say his name, but his son was incredibly fit, going to be a basketball player, and was on his way to being professional. Now he's got myocarditis, and he kept going back to hospital. I think on the fourth time, my friend, who was, wasn't aware, was suddenly said, I was in the hospital. I was going to the doctors. Is this the jab? Is this the? And he was getting angrier and angrier until two doctors basically said, we're not allowed to say that.
Mm-hmm.
And this is the interesting thing, because I've been in hospital. I had brilliant care from medical staff that were in the trench with me trying to save my life. So I'm not putting down the medical staff, but I don't understand this. We can't talk about it.
It's extraordinary.
From the doctors.
Oh,
I don't understand.
I can.
Okay, go ahead, Paul.
It started with the APRA March 2021 position statement saying to all health practitioners, you can't say anything negative about the blessed synthetic gene therapy. But they didn't call it that. They called it the rollout. And I'm evidence that they did come after you if you raise questions, and that's all I ever did.
And as I said, working in health, and I didn't realize at the time, but I just have so much admiration and for those professionals that had that foresight to not only to understand what was going on, the risks involved, but to stand up. And so many didn't stand up, and I've just got so much admiration.
But my thing is, though, APRA comes out with that first before they have the real data of all these injured people.
Oh my God!
But once they have the data, you can't ignore it.
It doesn't make sense.
That's what I don't get. They still ignore it, and instead they're still attacking doctors as we speak. Miley Trin, Dr. William Bay is under attack again. All these other doctors, Yeah.
Let's just call it out for what it is. It's in my eyes, at least, it's such a mess now. Those that have made decisions need to double down, and we need to they just hope it'll go away. And of course, we're here to tell the stories so that hopefully there's recognition and accountability for those affected.
Well, Matt, your story and Reese's story is important because even today they're still trying to say rare and mild about myocarditis. And you are here to show that it's not always mild. Having to go on a heart bypass machine, an ECMO, needing a transplant, and an implantable defibrillator is not mild, and that's one of the things we were calling out from the start, that it's a bit like safe and effective. They're both lies.
But Paul, surely any product that is known to cause heart inflammation, and then our drug regulatory body says that it's mild, self-limiting. The medical condition causes inflammation of your heart. So I think if you said to anybody who is still taking these products, by the way, we know for certain, because now there's a black box warning on the product, but we know for certain that this can cause inflammation of your heart. Are you going to take this product? And I challenge anyone who would still take the product knowing it can damage their heart. And it's astounding. I just do not understand it.
They put images of cancerous feet and tongues on cigarette packets. So imagine if they had, and I'm sorry about this, but this is Reese. Imagine if they had that on the Pfizer packet. People would suddenly go, what the hell? And so it does seem that what APRA is doing is protecting big pharma's products. It's hard to see it any other way. Can you tell us what's going on here? Because is this...
Yeah, so
back on?
So that photo there, Michael, was after Reese had been intensive. So the story I told, and then January last year, 2024, we had to admit Reese with end-stage heart failure. So when we got him back to hospital, ironically, astounding, apart from shortness of breath that he'd had due to his heart failure, he had no acute respiratory symptoms that would suggest a respiratory infection, for example, pneumonia or COVID. And the first thing that was done is every time he entered hospital was to do a PCR test to see if he tested positive for COVID. And of course, he tested positive for COVID. So I was home when my wife had taken Reese up there, and so the first thing that was happening, and I always want to say, look, the medical people, there's no derogatory comment against the medical staff. Absolutely brilliant.
Yeah.
But the policy said that yes, we need to test for COVID. He was put in an infectious diseases ward, and he was given remdesivir. So now this is what I say when you advocate for your own and with some knowledge that you've got. And I've never done this in my life. I've always been a real follower. And I said, I don't want you on that product. So I rushed up to hospital and upset all the cardiology team. And I said, look, he's got no symptoms. Does he need to be on this novel antiviral, and that's known to cause effects? And the nurse told me, well, that's not your decision to make. It's the patient's decision, because he's 24 years old at this stage. And Reese fortunately said, no, I don't want to be on this product. So a chief medical person came in and said, look, what's the concern? What we'll do is we'll retest. we'll retest for COVID, and we'll stop the infusion, retest for COVID the following day, which they did. And I phoned Reese up the following day and I said, what's the story? And he said, I'm negative for COVID.
Good.
Now, there's one or two things happened there. The PCR test wasn't accurate, which, or secondly, the medical people did me a solid favour, because I showed reluctance to let him have that product. So, and within a few days, he was sent to CCU with excruciating abdominal pain. They couldn't get on top of his abdomen was full of ascites, abdominal fluid due to his end-stage heart failure. Terrible night. My wife and I spent the night with him in CCU. He was just in tears, in pain. It was terrible. The following day, he was admitted to.
How are you coping with that, though? No, as a parent, it's your son.
So we spent 80 plus days every day in hospital with Reese. I'd go up at 5 a.m. to rub his feet and give him a heat pack and try and get him to lift 1 kilo weights to continue his strength. What it's done to our mental health, I think my wife's pretty tough, but it's very difficult to see. So
But you've got two things, because you were in the health system, so you're waking up to maybe not everything is hunky-dory, and here's your son, who you obviously loved to death, and here he is injured. It's, man.
We just stayed positive, and we had a lot of faith in the medical people, but I don't think I'd allowed my head to get to what we're looking at, what the prognosis was. You go day by day.
I wonder about the remdesivir thing. I know in America they charge quite a lot for it. I wonder what incentives. It'd be interesting to hear what incentives they had for giving remdesivir, because you're giving it very late in the game. Like you said, it's got problems with liver and renal, kidney toxicity. And I used to get calls from people in hospital, and they had their loved one in hospital, and they were going, and they were calling me freaked out because of the intense pressure. You were treated with relative respect, I think.
I've got another story with the antivirals, Paul, and previously with one of Reese's admissions, he was diagnosed with COVID again. Can I say, when he was first taken to hospital with his cardiac arrest, the first thing they do was test him for COVID, and he was negative for COVID. So of course, early on, myocarditis was caused by the virus, not by the therapeutic. So that put a kibosh on that idea. So he was negative then, but tested multiple times afterwards for COVID with no symptoms. So, and he was put on molnupiravir, which is one of the other antivirals. And I can tell you that's subsidised by the Australian government because the price was on the bottle. The product cost $1,200 for maybe 20 tablets or so. So when I said to the nurse in infectious diseases at the start of last year, can he not go on molnupiravir? Because I thought, well, as far as I know, that didn't cause any problems. And she said, well, we don't think that works. So our you know, we're fortunate we live in this country, but our government's subsidising. God knows what's happening now, but they were subsidising molnupiravir. It cost me $29, and the product was about $1,200. So, and then from the infectious disease department, they said we don't think that one works, so we're going to try remdesivir. So that photo that you showed, Michael, was that was the day. That was after 80 odd days in ICU, and
80 odd days in ICU.
So the plan after being on, so he's placed on ECMO, which is life support to try and improve the function of the organs and oxygenation to the organs, and because we didn't realise how unwell he was by the time we got him back to hospital February last year, and so the idea was to have him on ECMO for about a week, and then to do a procedure called a left ventricular assist device, an LVAD, which is it's open heart procedure that a device is surgically implanted into the. You pull out a piece of the left ventricle, the base of the left ventricle, and it's like a turbine that will bypass the function of the left ventricle that's pretty much non-functional. That was open heart surgery. He had to go back into theatre to open his chest again because there were clotting issues and problems there, and that simply didn't work to support his heart adequately. The right side of the heart didn't compensate for the extra flow to the left side of the heart. So, the medical personnel did an amazing job to come up with solutions to support the right side of his heart.
Yeah,
brilliant people, and they came up with. So he needed another open heart. They had to open his chest again. The second time his chest was open, they kept open for about a week. So I don't know if you saw there was a dressing there with his chest open. It was pretty horrific.
Yeah, here. Is that it with the blue?
Yeah, I think that was after the second operation. They decided to keep his chest open because they weren't sure with clotting issues, what have you, with the LVAD procedure. So they decided on another ECMO device that supports the right side of the heart. So basically, from that period on, he was on two machines, one to support the left side, one to support the right side of his heart, with his chest open some of the time, and trying to keep his heart going. It got to a point where it really was horrific because we were looking at the monitor and all these parameters. And we could see that things just weren't going well. In fact, he probably had defibrillations, obviously the shocks. He went into cardiac arrest multiple times, and we stood there while they shocked his heart, multiple times during the night. We'd go home in tears, wondering if he's going to make it through the night. We'd phone up in the morning and we'd say, we had to shock him 3 times, 4 times. And they got to a point where they stopped monitoring his heart because they couldn't get it back into normal sinus rhythm. He was in constant tachycardia. The heart was racing at 200 plus beats per minute, just in this constant fibrillation.
God, he's tough.
Well,
this
look,
we're tough kid.
Yeah, but Michael, honestly, if he didn't receive his initial basic life support with the defibrillation when he had the arrest and without. We live 8 minutes from one of 4 hospitals in Australia that do heart transplantation, and they're just brilliant professionals that kept Reece alive. There's just no question about that. So I always try and differentiate when I talk about things.
Yeah.
We've got a brilliant medical system. There's no question about that. But we've got a system that won't allow the medical professionals any autonomy to speak out and to make their own decisions without over regulation, I think. And so that was the third operation to support the right heart.
Well, I've had my chest opened because I had the bypass.
I know you did.
No, honestly, a lot of people have it. The thought of having it opened and reopened that's wow.
Well, I try and so it was open once, had to reopen the following day. That's 2. They kept his chest open, decided to close it. They thought things were good, had to reopen it to do this right heart ECMO. That's 3. Closed his chest again. As a result of the surgeries, he ended up with a pleural effusion, so fluid on the left lung. We thought that might have been a pulmonary embolus, which is a clot in the pulmonary arteries where you can die just instantly. So they had to put a drain into the side of his chest, so intercostal catheter, and that didn't go well because he was so unwell. His lung inflated too quickly, and his lung was non-operational. He had fluid, whether it was blood or fluid in the lung. So that was an urgent situation. They told us they were pessimistic he'd survived that, and they stabilised him and then worked. Of course, the idea was this was all as a bridge to transplant.
Can I just ask, Matt, were you able? Was he compos mentis? You were able to talk to him during this time?
So he was intubated a lot of the time, Michael. So so kept at a level of sedation where he's on the precipice of consciousness. And because they had to try and get him to keep up his strength with doing some little weights or on a bike and what have you. But he's intubated and he's sedated on.
Is this here? Can I show that? Is this after the operation? This.
That was actually at the tail end of the ordeal, but they were working on things prior to transplant, that same sort of situation. So it's amazing what they can do. And so they stabilised him after the collapsed lung, removed him from the transplant list, of course. So we had this roller coaster. The only thing that was going to save him was a transplant. If you become too unwell, they delist you from transplantation. They won't waste an organ on a patient they don't think will make it through. And got into a point where they took a punt on him to relist for transplant. And they were trying to do some physiotherapy on what they call a tilt table. He's strapped down with these ECMO cannulas to his legs. And one of the cannulas dislodged from one of his major blood vessels that was keeping him alive. And he had he had another arrest, passed out, and they had to do an emergency sternotomy. So in other words, to reopen his chest in an emergency situation on his ICU bed. But let's be honest, he without those brilliant people there, it wouldn't have ended how it has. I won't mention the doctor's name, but he saved Reese's life, and very humble.
I found the heart surgeons. I was in Prince Charles. I found the heart surgeons were extraordinary.
Oh, they're incredible professionals.
I was in awe of them, to be honest. Just
Well,
the way they were going.
I have no issue with that. I mean, I have a lot of respect.
Yeah,
I mean, this was also. I did some cardiothoracic work and a lot of resuscitation, and so I can when you talk about the ECMO cannula coming out, I can really get a sense of what a shit fight that would have been.
Can you talk through that, Paul? Can you give an example?
You got these really big, these aren't these tiny little cannulas. These are big cannulas and major vessels, and they're keeping him alive, and they're pumping fluid, and if it suddenly comes out, there's going to be blood everywhere. There's going to be bleeding. There's going to be it's really a miracle that Reese is. It is a testament to what I'm trying to say is you can have a respect for all their work, but my concern is that there is a part of their thinking which is not aligned with. I'm not talking specifically about the surgeon or specifically about the doctors resuscitating him, but the whole profession is somehow. There is something missing in their thinking, which is why I think a lot of us have a problem with trust now, because they're not open, they're not this, it's almost like a type of mental state. So you still see the good professionals in there, but they're in a profession which has squeezed their perception and their minds in such a way that you think, well, am I safe? Am I safe?
And I look at why that is the case, and obviously training sends you down a very narrow path when you're training in anything medicine, I think. But to be honest, it's regulatory pressure, and it's the financial benefits of just going along and doing what you're doing, because I've got to admit that. I mean, I honestly think if medical people had an opportunity to speak out about what they saw over the COVID period, and they were earning $40,000 a year, I think many more would have spoken out. Not when you're earning hundreds of thousands of dollars a year. So I get it. I simply get it, and that's what's so frustrating for those of us that work within the industry.
The other thing, though, is before we move on, to talk about the transplant, they changed, I believe, the definition of vaccines to allow this to be called a vaccine. There was alternative treatments available for COVID, which they banned. Because if they acknowledged them, then they couldn't have rolled this out. Mm-hmm. It's hard to get away that for some reason this vaccine. Well, it's not a vaccine. Paul doesn't call it a vaccine. This is different. But you yourself, you said you're fully vaccinated every year. You didn't take the flu vaccine, but you were taking other vaccines to keep the job. When I was in hospital, I was doing my walks to exercise, and some nurse came around. All the nurses were in the nurses' station, and she came around and said, "Okay, I've got your vaccines." And I was watching the nurses go, "Oh, yeah, look, I might take mine tomorrow." They were just scurrying away from her, not wanting to take it, but realizing at some point they have to if they want to keep this job. And the beautiful thing, I know you talk about the money. I know that's important, but I heard this beautiful nurse, a male nurse, say one night to this old guy who was asking, what's he doing this job for? And he said, I used to be a stockbroker, but it was empty. And I just like helping people. And the job gives him great purpose. And this is another thing. They like helping people. I actually think our compassion was used against us to get this thing out. I don't believe it's just always money. Maybe I'm naive, but I just don't believe in the health system it's always money. Where I saw the doctors, the nurses, everyone else, there's something else. They really seem to enjoy the job. And I believe you probably enjoyed the job, Paul, before everything went to shit,
I did. It was rewarding. But now more and more I'm seeing them as a cult. I think that's what I was trying to say when your comments said that a cult that I'm no longer a member of. And it's hard because there is definitely great feeling of being able to save a life, like Reese's is incredibly fulfilling. But when I made the calculus that I wanted to keep people like Reese out of hospital. I wanted to, it was really clear that children and young people didn't need the shot, whatever you call it. I call it a synthetic gene. And so it didn't make sense that they were pushing. And I was furious, and I tried everything to. I would make submissions to the FDA. You know, I did podcasts with different people, and to try and head off this insanity, because I could only see harm coming from it without benefit. And they ignored 100,000 submissions. We got it from 300 submissions to 100,000 submissions, and they ignored it, and they just rubber stamped it. And, you know, and that was the fight. And, you know, I see studies like I posted about a Hong Kong study. They have good pharmacovigilance, and young boys, teenagers, 2 to 17, one, you know, only a year or two different from Reese, and they had 2,700 cases of hospitalized myocarditis on their register. And I was going, come on, you're saying it's rare. And then I saw the study Mansugan from Thailand, where they, you know, over 2% of the this is boys having their second shot. 2% had this.
When we look at history, Paul, that it just doesn't make sense to me. I mean, the swine flu vaccine was removed was it one adverse event or one death from the product? I looked at the TGA's at DAEN, so database of adverse event notification. About a month after this happened, I thought something just doesn't add up here. And on the TGA's own website, 130,000 adverse events from this product on a self-reporting system that, to their own admission, is 30 times underreported. And I say that to people, and there's currently over 1,000 deaths and 140,000 adverse events, and we're still selling this product. If somebody can please explain to me.
I saw it in Paramount in pharmacists today.
Well, you walk past the little boards outside chemists, and yes, you can go in and get your free product. And I walk past and just shaking my head every time. And I look, everyone has a decision to make themselves, but you can't deny people the information they need to make legally binding informed consent. So if they're not going to tell people what's happened, I think that's what I'm doing here, is to just tell the story, tell people. And of course, I still get people that say, "Oh, Matt, you don't know that the vaccine caused Reese's problem." Well, well, we know his history. He was fit and well prior, so we can look at that. We can look at the symptoms that started within a week, that developed, obviously. His explanted heart has been tested. There were no anatomical anomalies there, so there was no problem with the arteries, or his heart muscle was scarred. Something scarred it. We know he was negative for COVID when he entered hospital. So if someone else can tell me what happened to him, legitimately, I'll stand corrected. But for people to know, to hear these stories time and time again, to know the number of adverse events, 130,000, 30 odd percent, I think they said, required medical care, and we're still selling this product. It's astounding. It's astounding. No, I just can't understand.
We work with Sharon Cousins.
Yes, I was going to bring up Sharon.
To mention the Open DAN. And so this is Australian data, and what I've got up there is just myocarditis, not all the other cardiac terms or the cardiac arrest terms. This is just myocarditis, you know. And you're quite right. There is a large number of, just a huge number of reports, and we know from the data. There was a study done a few years ago. It's called the Harvard Pilgrim Study, which is where they realized that only about 1% of actual injuries and adverse events are reported, and that's where it comes from, the Harvard Pilgrim Study. The system we've got, this is purely passive, and it misses a lot of reports, and a lot of people who have died or have been injured, they don't make the connection, and certainly their doctors haven't been making the connection. And then to make things worse, in Australia, we don't have a single pathologist who is willing to do the appropriate tests. That can, like, whether it's the DNA contamination and finding plasmid DNA within the cancers, whether it's people like Caitlin Gotchi, 23-year-old, dies suddenly. They blame it on asthma, but she had an enlarged heart. And the family wanted to know that, and they're saying it's asthma, but she clearly had the jab, dropped dead with an enlarged heart. And no one in Australia, none of our pathologists have done the appropriate histology where you actually take the heart, do the slices, stain it for things like spike proteins, stain it for the type of immune cells, which would show the myocarditis. That's how you show myocarditis. You show the infiltrate of immune cells. You can show the staining of spike protein. You can show nucleic capsid, which would suggest viral infection. So they could do all that, but not one pathologist in Australia has yet stood up, like people like Arnie Burkhardt, Ryan Cole in the US, David Spiker in Canada, Roger Hodgkinson. We've got a handful globally, Arnie Burkhardt in Germany, but not one in Australia. It's very disheartening.
Can I show you something, Matt, before you go on? Can I just show you something? We've done 6 of these, but we've put 3 here together. We asked people 2 questions in gatherings. Stand up if you know anyone who was killed by COVID. And then the next question is, stand up if you know anyone's been injured or killed by the vaccine. This says one's in Sydney, one's in Mount Gambier. I can't remember the third one, but watch this.
Stand up if you know of someone who has died of the jab or has been injured by the jab.
Oh, no, that was the jab version. So this is basically when we do it, and we did it recently in Sydney, I stand up if you know anyone who is injured by the vaccine. And no, it was not by the vaccine, who died of COVID. And we might have one person out of 250 people stand up. And then we say, stand up if you know anyone's injured by the jab, and the entire room stands up. And this happens time and time again.
My observational data, because I still work with patients, and I just sort of tinker at the edges of what I'm allowed to do, I suppose. But I know, people I know that didn't vaccinate for COVID. Here we are in August 2025, and they're all fit and healthy and going about their jobs. Yeah. Fortunately, I don't know anyone who died from COVID or was hospitalised from COVID. But I know elderly people at work even that if you don't take the product, fortunately, and no disrespect to people that have been affected by the virus. So my observational data is that the majority of us probably would have been a hell of a lot better without touching the stuff.
Well, can I ask? Let's get to the heart transplant itself. When did you hear that they'd found a heart? I mean, that surely once they have a heart, it all happens very quickly.
So that photo that you showed there with Reese's chest open on ECMO, was on the Thursday morning. We went up there and we thought, things were getting really desperate. His chest was open there, and there was actually a dispute between the ICU staff and the cardiothoracic surgical team what to do, whether to close the chest again or to keep the chest open to wait for a heart. And they took a punt on Reece that he would survive the transplantation process, which was the first thing. I mean, quite simply, they could have said, well, there's nothing we can do. We're not going to risk a transplant. They did. That was on the Thursday morning, that photo there. We thought we were saying goodbye to him. And I remember it vividly. And the surgeon was standing there and he said, come here. and he said we've got a heart, and it was the most emotional thing we've been through, and so the heart went in Thursday night. And there's a photo. That photo of Reese riding his push bike is on. So the photo with his chest open is the Thursday morning.
Oh, I see. Yep.
The
So
life-saving heart goes in Thursday night, and he's pushing the bike with the new heart on board the following day. It's an extraordinary story. So that is the morning after. That's 12 hours post heart transplantation.
Wow.
So the photo before was the day before, and
I know they get you up to walk. They did that to me, but I think a bypass and a heart transplant after what Reese has been through.
Well, that was 80 days on life support. So,
and how long did the operation take?
We went home that night. They said you might as well go home. We'll let you know. They said it was a quick procedure, took about 4 hours, and it all went very, very well. The actual transplantation itself. So,
And how is he now?
He's still home. He got home at the photo there, I think, with his shirt off, was when he first stood up in the ward after this one on the right there.
That's on the right,
Of course, that's the scars from the ECMO and the chest being opened up, and there's a portacath scar and the lung collapse under his left arm and the ICD in his left chest up the top there. There's another scar. They had to do another drain on the back there, and he's got scars in his groin from the ECMO and nerve damage and what have you. So the damage is very extensive. So he got home at that weight, probably at about 45 kilograms, I think.
45 kilograms.
Well, he hadn't eaten for whatever it was, three months or so. He was on what's it called, Paul? PNR, parental. Yeah. Nasogastric tube.
Through the nose, yeah.
But he's now he's able to get into some physical activity, some gym, and he's putting weight on, and he's doing reasonably well. He's still not working, and I don't think he gets through a day at work, but he's getting stronger all the time. So it's a miraculous story.
And what's his attitude to life? Does he feel like he's had a blessing? Even wondering where the heart came from. Do you guys know?
We think we do know. We think we do know,
oh, wow.
And it's obviously that's not that's not.
No, you don't have to.
It's through an intermediary that you find out, and that story in itself is just it's heartbreaking what happened to the other person. I won't go into it, but and we've reached out to the family of the donor. Also a young person who suffered an accident. So every day we feel for the family of the person who donated the heart, and it's an incredible story.
It is. What's really incredible is the paradox, because here Reese has to go all through this from a medical product from Big Pharma, and yet at the same time he's saved by the health industry.
That's what happened.
That's how it is. Even this, and what keeps him alive, it seems to be, he has this enormous fighting spirit, this will to live, of which the health people joined his team and fought for him as well. It's incredible,
Yeah.
And what's the prognosis going forward? With hearts, is it guaranteed for 20, 30 years, or what do they say? I know.
Yeah. So he when he got home, on immunosuppressants, anti-rejection drugs, and anti-inflammatory medication, prednisolone, and blood pressure medication, and cholesterol-lowering medication, and high-dose magnesium. The transplanted heart needs a lot of magnesium. But that medication has dropped off. He'll be on immunosuppressants his whole life. He's also, since transplantation, he needed a heart biopsy monthly or every 3 months. He's had about 4 or 5 of those. He's had coronary angiograms looking at the arteries. Everything's gone very, very well. So they sort of, you think a transplanted heart fibrose can harden over time. So they sort of say, maybe it's a 30-year.
I want to ask you a question now, but and I'm sorry if it's insensitive, but I think it's important. You said when you talked to me on the phone that you asked your kids, have you got the vaccine yet?
I think we
And
did.
so,
Yeah.
So do you have any guilt yourself? Have you forgiven yourself for that? Because, you're unaware, you're an innocent victim of this too. Are you harboring any guilt of that as well?
Oh yeah, I'm just an angry, terrible old man now. But and then people say, well, 3 of your children had this product, and my wife and I did as well. Why did only one person get affected? And that's not for me to answer why that is. Whether there's different doses or different strength. We know the manufacturing process changed midway, don't we? And but so yes, I certainly often think I don't think I harbour guilt for telling the kids, because let's be honest, I wasn't aware.
Yeah, that's the truth. You weren't aware, so that's the truth.
And in fact, interesting. A sibling I spoke to, and I was probably virtue signaling a little bit, working in health, and I said, why don't you just go and get the vaccination? So I was a little bit late to get it myself for work, and but of course we weren't hearing of any adverse events, and that was intentional, that we didn't hear of any problems. So yeah. I'm very, very angry with the people that have kept the real information from me. That's where my anger lies.
Yeah, fair enough.
I do wonder about what, you can't see it, but in the open DAN, you can see these are all different batches, and you can see there are certain batches.
I'm sure
that were particularly a problem. So I don't know if it's possible to get that record, but
yeah, I haven't. I sort of went down that path, and then I got a bit tired with it, so I didn't.
Yeah, fair enough. What would you like to see happen, though, Matt? Would you like to see like a proper royal investigation?
Well, I mean, I'm just so appalled by. I understand it, but I'm just appalled by the political response. To see the I don't know, mention the ex head of the association, the organisation that approves these products, to sit in a Senate hearing and still, it looks like still feels that there's been no wrongdoing, that all the correct decisions were made, whether that's just a facade to protect himself, but that makes me very angry. I want to see accountability for the people. I'm glad I wasn't in their position having to make these decisions, but as Paul knows, any of us working in health, or you, Michael, with what you do, if we do something wrong, we need to be held accountable for the decisions we make, and as simple as that. And I don't think politicians or bureaucrats should be above that. Yeah.
We need to ask the questions. How did this happen? I mean, it was pretty. The thing that gets me, as we move on, I have nurses now who have had enough. They've been quiet for 3 or 4 years, and they tell us, I had one come on she talked to me in person saying that she was working in the ICU. She said they were empty. There was no COVID. There was no COVID patients, major hospitals. And she said they were saying that the hospitals were full. They were lying.
This is more of my observational data. I spent 80 days in ICU at the major heart lung hospital here. And I did some research, just talking to people, talking to the ICU staff. They have 3 units of 9 beds, so 27-bed ICU. And I asked what at the worst of the period, and they, by all accounts, observationally, they weren't full of people with COVID complications, fortunately.
So, but to me, this is what has to be investigated. They were lying to us. At what point did they realize COVID was nowhere near as dangerous as we were being sold? At what point did they know this vaccine was more dangerous than COVID? And why didn't they stop it? Like you said, with the swine flu, they stopped it. Remember that strawberry thing? They found one pin in one strawberry, and every strawberry on every shelf in Australia was removed. So this is the thing that doesn't make
It doesn't make sense. My understanding is that study from Israel, that my understanding is that they were one of the most heavily vaccinated population early, and they contacted the FDA, and my understanding, as did the Western Australian Health Department, to comment about, can you please explain, we're seeing evidence of myopericarditis and appendicitis, I believe. So how can that get back to the people that are approving this product and it still goes ahead? It doesn't make sense to me.
No, the culture, one of the things that directed me towards retiring and fighting what's going on in the profession is that the culture of safety, in anesthesiology, critical care, you're always looking for risks. You're always trying to avoid risks. Like airline pilots or aerospace engineering, and that culture just went out the window. It's like now they're deaf, dumb, and blind to risks. They won't hear it. In fact, they attack you if you say, "Oh, I think that could be a hazard." Oh, you're sacked. It's the exact opposite of a culture of safety, which I grew up in, understood as my profession and my role. And I never expected that I would be attacked for
upholding your Hippocratic oath.
For raising safety.
That's right.
Yeah.
And we forget that it was 2 or 3 months ago that the TGA removed the recommendation for vaccination for COVID for children and adolescents.
We have
people with the spiel to say that even at the heat of the pandemic, the benefit didn't outweigh the risk.
Yeah,
my goodness.
Yeah.
I know. And we have people, George Keswick, Rosemary Marshall, Robbie Roach, and there's another team, and they go to pharmacists. First they said a cease and desist, saying, but now they take that letter from the TGA and go, are you still vaccinating pregnant women and young people? And some are saying no, but a lot are saying yeah. And, so even though they've published it, they're still doing it. And there's this, it's, I don't get it. I don't get why we, even from a survival instinct, why the survival instinct in people isn't kicking in, because I interviewed a taxi driver today in Coma, where are we? Cooma. And he didn't take it, but he was an essential worker, so he was allowed to keep driving. And he says all he hears is people injured and they can't put it together with the vaccine. But he says he's literally had 4 years of just people talking about their injuries in the back of their vehicle and dying, getting Alzheimer's, getting this. There's something wrong. And I know in the hospital, one nurse, because at one point they thought I had pericarditis, and I mentioned myocarditis, and this nurse just went blank or looked distant, and then she said, yeah, we had a lot of that in here for a while. And then that was it. That's all she said. Then she moved on. And I remember thinking, wow, So, man, you've been through hell. I'm really sorry for you. I'm really glad your son's alive. I've got a 22-year-old son. It's if anything happened to him, my God. So it must have been real torture. I'm glad your family has stayed together. Got a lot of families break up in this, so I'm seriously glad your family stayed together. And I'm personally, I got no judgments either way. I just think this is an absolute tragedy, and our government should really address this, because something is terribly wrong. And they would find more respect from the population if they actually said, okay, we're going to look into this.
Well, I don't expect it's going to happen anytime soon. I mean, Mr. Albanese apologised for the thalidomide disaster 12 months ago, I believe. So, and we're talking, 50 odd years ago. So obviously, if anyone can be drawn into any sort of responsibility, there's not going to be admission of that.
No, and now we have a vaccine, mRNA factory in Victoria, making 100 million of the bloody things a year.
I tell people now that I'm fully vaccinated, and they say, "Are you an anti-vaxxer?" And I said, "I think I probably am now." And they said, how can you say that? And I say, well, there's a couple of things. When the liability of the vaccine manufacturers, when the indemnity for any liability gets removed, I might consider taking one of their products. But and people say, what do you mean? I said, well, there's an indemnity for these products. How can that still be?
Do you know what's scary, Matt? So this new technology that they were calling a vaccine, as I keep saying, is a synthetic gene, with lipid nanoparticles. So it's designed to transfect genetic material. Well, in America now, in various states, they're trying to give indemnity for insecticide manufacturers. You think, why the hell are they trying to now give another class of? I've discovered that the parent company of Moderna, Flagship Pioneering, has a spin-off company called Tarana, not the car, and it is a synthetic gene, a synthetic RNA that they're spraying on crops, and they're calling it a biopesticide. So it'll get liability. So they're trying to get liability for yet another synthetic RNA product. This time they're going to be spraying it over food, and they want to give it. And they're moving rapidly because they say, "Oh, that's just a pesticide." So we're giving liability to pesticides. So this isn't over. These guys have an agenda. I think of this RNA as a type of toxin, a poison. I don't see it as a therapeutic. That's why they're giving it to the over the plants to kill insects and to kill funguses. And it's very clever because unlike old-fashioned insecticides, it's you can specify, you can silence. This is called RNA interference, small interfering RNA. So they can switch off the genes of the bug, of the beetle or whatever that they want, and it just dies. To me, it's just a very well-targeted poison. Now, is that better than using insecticides that kill generally? Maybe. But the fact that they're trying to make insecticides liability free is a real concern to me.
Paul, do you think there's any prospective benefit from the mRNA technology for cancer therapy?
I have my doubts. Whether it's a bit like with the COVID shots, they're trying to say that you can prevent the flu or prevent COVID with an intramuscular injection, right? So you're delivering the compound, whatever it is, in this case synthetic RNA and DNA, into the wrong immunological compartment. They never had a shot that worked for coronavirus. They tried on animals, and the animals ultimately, died on re-exposure. They got antibody-dependent enhancement. So I had reasons to be really concerned about the approach. You probably need you probably need a nasal spray or something as a capsule that presents the right antigens to the gut, which is what Professor Robert Clancy is talking about, because the immunity of the lung actually gets processed in your Peyer's patches in your gut. So I just think that the thinking is all wrong. The approach is all wrong. I couldn't even see, and I posted this on my Substack a few years ago now. Professor Suchrit Bhakti was saying, it can't work. It's the wrong compartment. It's the wrong sort of shot. So to me, the whole, although like you, I had all the vaccines. When at my disciplinary hearing, they said, "Are you vaccinated, doctor?" I said, "Yeah, I'm fully vaccinated. I've rabies, influenza, TB, hepatitis B, you name it, I've had it all." And oh no, they said the COVID jab. I said, "But that's not a vaccine. Let me tell you what this is." So I think that's the problem. We have some very clever people, but there is some very bad thinking going on. stuff that's not scientific, which is not logical. And I hope that people will wake up to truly evidence-based and much safer approaches to treating respiratory infection.
So what does the government do now when they've invested so heavily in the technology? They're caught a little bit between a rock and a hard place now, aren't they? With that sort of investment and all the fanfare of the technology and the new platform.
Could it be, like I said, by the same token with these sprays that they're calling biopesticides, which are bits of RNA, synthetic RNA, on a native background of a natural plant virus? You can see the argument for promise, and they're using the terms like AI and big data processing will produce these highly targeted, individualized cancer therapies, and it's not at all clear that these will work either. And they're completely, just like with COVID, they're completely forgetting about vitamin D. They're completely forgetting it. They're not looking into cheap repurposed drugs like Dr. Mackes talked to us about a few weeks ago. You can see everything is about very expensive, very high tech, and dubious. And I would like us to get back to decentralized medicine, stuff that we can empower people to take health into their own hands and not have to take out a mortgage for some super high tech stuff that may or may not work.
Yeah.
I think it's the same with asbestos. And what you were saying, they've invested asbestos, which they built so many buildings out of, including schools, and thalidomide in a way. Thalidomide, it took them 20 years to ban it, even though they had the evidence. So I think from a humanistic point of view, this will sound idealistic, but I just wish people would put people before profits and say, look, this looked good on paper. We tried it, but we've done untold damage. There's the next thing coming out from ROS, from the Lighthouse Declaration, is that infertility is going through the roof. And the numbers, is that to do with this mRNA jab? I don't know. But the fact is if it is, or if there's even a chance, we have to stop and study that, because we can't be the generation that makes the next generation infertile just to make a couple of bucks. We can't be that generation. How can we ever live with ourselves?
It's an amazing conversation. Amazing conversation I have with people about the faith I have in Mr. Kennedy to make a difference, to uncover some of these questions, and you can imagine the response.
Yeah. He's up against everything. Huge corporations against him. Chances are someone would pop him off if they could. So I think I still hold out hope for him, but I still think ultimately it comes down to us. We've got to stop this. Rather than just being slaves hoping our masters will treat us nicely, we've actually got to say no. Look, there's too much damage. And it's that's what I've been telling people forever. The she'll be right era, where we just used to blindly trust, is over. And now it's the time. Okay, who are we as Australians? Why are we broke? Why are we sick? And where are we going? Because the place you want to take us doesn't seem conducive to our souls. So I think these are the discussions we have to have, and talking in this time of silence. And people are defaulting to silence like good communists, trying to stay safe. Talking takes a lot of courage, but once you start talking, you realize actually this is all right. I'm doing what I'm meant to be doing, and that's what you're doing, Matt. This is really important. I hope you go around the world, Joe Rogan, anywhere we could. It'd be great to see you telling this story and giving some meaning behind what your son has gone through. And I truly wish your son the best. I really do. What a fighter. Is there anything else you want to say before we toddle off?
No, I think that's it, Michael. I suppose really and that's why I'm here telling the story, is just so people can see what has happened. They can draw their own conclusions. But don't close your eyes to the fact that this has happened. It's real. People are hurt. People are damaged. And and it hopefully gives others that have been affected the courage to speak out and tell their stories. And that's simply why I'm here.
Can I ask one more question? What's your relationship with your son like now?
Well, very good relationship. He still tells terrible jokes like he did previously, but so he's home. I'm still working, so we've got a great relationship, and we've got 3 children.
That's great.
A great relationship. Yeah.
That's
we're so fortunate.
Yeah.
Yeah.
God bless you, brother.
Yeah,
We're
we're very grateful, Matt, for you coming and telling us the story of
yes,
your incredible son and incredible family. And I know I'm not the only one who's feeling chills, about hearing what you've been through. And may it be of value. May it mean something.
So.
Absolutely. Absolutely.
May it move the needle. And like I said before, the key lie is it was rare and mild, and I have real concerns about the rare part, but your Reese's story really puts paid to the mild part of it.
Yeah. And if anyone else is out there where their son's gone through this, or their daughter, or even themselves, now's the time to talk, because if we don't talk, they'll continue. We have to get so many people coming out and talking that suddenly they have to take it seriously. This should be on 60 Minutes. It shouldn't be with me in a bus in a car park in, where am I? Cooma. And Dr. Paul with his rose-colored glasses.
We haven't gone there to work out why it's not on 60 Minutes, but just have a think, people, of how terrible the situation is. That listen to my story, 60 Minutes, and give me a call.
Yeah, I totally agree. This is where it should be. This needs to be a national conversation. What are we doing to our young people? What have we done? And how do we rectify it? Or how do we stop it happening again in the future? If we don't do that, but then I don't want to go there. Thank you for coming on, Matt.
Thank you so much.
It. You've done a great interview, and maybe I'll meet your son one day, but I wish him the best, and your wife, pragmatic as she is. And take care. We're going out with The Lucky Country. This is our song. We're going out with this, and we'll see you all tomorrow, guys. Take care.
Thank you.
When I met Jesus Christ, he was almost 10 years old, and he was helping his mother push a trolley full of all they owned. And because they couldn't find an inn they could get in, they were heading to the city and leaving Bethlehem. Couldn't you perform a miracle? I'm out of them, he said. I tried turning nothing into warmth, but it just made my mother cry. It just made my mother cry. Mary Magdalene has become a man, and tonight he's old, and she has been riding my tram. Now it's late and she's trying to sleep beneath a poster for a bank. Your dreams are important to us as it bathes her face in gold. Come give us your natural gifts, we make wealth from toil. Come pretend for history's page that we're advancing Australia fair. Let's pretend that we're all advancing. So head